I did pills for a while and then transitioned to heroin.
Narrowed down to methadone and Oxycontin more and more every single day. Heroin pretty quickly after that.
I was to the point where I had to put a needle in my arm anywhere from 6 to 10 times a day.
We are in the midst of the opioid epidemic.
I was just over it. It was done. It wasn't worth it anymore.
Addiction is a disease. No one chooses to be an addict.
And I hear these journeys that these women go on, and it is usually a very slow process, and then one day it's just turned a corner that they can't come back from easily.
There's help out there, that they are not alone, and that there is proof that the treatment works.
The Choice Program is a program for pregnant women or women who have recently delivered their babies and are still in the hospital that struggle with substance use disorders.
There's not a single woman that comes in that asks for help that will be rejected immediately.
And when I actually got into the program, it was just a huge weight lifted off my shoulders.
When you find like a provider, you find like a doctor's office that actually cares, it makes a world of difference. It really does.
You know, I dealt with nothing but judgmental and people looking at me like I was an awful person, and coming here, all of a sudden I've got this whole team of support, not just a doctor and a nurse practitioner, but everybody.
These women walk into our office and we don't necessarily see a patient. Everybody in the office sees a strong, resilient individual who deserves respect.
But there is no judgment in our office. Every woman that comes in who needs help, the help is there and will be taken care of in a non-judgmental, caring, dare I say, loving manner.
Nothing more inspiring than watching their journeys. They are warriors, and the way they fight for their recovery is just unbelievable.
I have pride in myself now. You know, I have a baby that needs me more than ever. So, you know, I could fail myself, but I could never fail her, which means I got to care about myself more.
These patients that we have taken care of may very well have had no place else to go. And if we'd have shut our doors and said, you know what, this one's gonna be too tough, then where would we be? Where would those patients be? And I would not be able to rest my head comfortably knowing that I could have done something and I did not.
If I wouldn't have gotten clean and came and got the support that I needed, I have no doubt in my mind that I would have been in a casket. By all means, I wouldn't be here today.
I never thought that I could get out of that routine. I thought I was hopeless. And I was a lost cause. I didn't see any light. And if I can do it, anybody can really do it.
We really take the patient from where they are and help them get to where they want to be. So if the patient's goal is full recovery, living independently, parenting their child, we can help them reach those goals.
Reach out. There's plenty of opportunities to get clean and to get your life back on track. All you have to do is want it. And that's the main key. You've got to want it, because if you don't want it, it's not going to go anywhere. You have to want this. You've got to reach out. You've got to ask for help. You can't do it alone.